is called Gleevec, or you will maybe know it more commonly as imatinib, which is used for treating breast cancer. Coming to the objectives of drug discovery, this is again to emphasize how collaboration is very important. You may have a chemist and a modeler, a medicinal chemist and a computational model, like a biologist or a computational chemist. They may be working together. So what the chemist is good at is like synthesizing, analyzing the yield, the experimental part of it, they're good at. And the computational chemist will do the in silico analysis. They can do molecular docking, structure-based drug design, ligand-based drug design, pharmacophore mapping, or ADME toxicity studies, QSAR, etc. So the synthetic chemist can synthesize the compound. So, but only if certain characteristics are met, right? Imagine the modeler, they find a compound, like they find a ligand with good activity everywhere, good ligand with drug design, like ADME properties are there, toxicity is not bad, everything is good. So they go to the synthetic chemist and say, hey, can you synthesize this molecule for me? And the synthetic chemist looks at it and they realize, okay, this is not synthesizable because the raw materials are too expensive or something. Okay, so in this case, the modeler has spent a lot of time, they have wasted a lot of time on doing all these analyses, wasted time and resources, but the molecule ultimately is not synthesizable. Or the medicinal chemist can synthesize multiple analogs of the same molecule and then go tell the chemist, modeler, I have synthesized these molecules, please find which proteins or which diseases I can target using these molecules. And that is also a difficult scenario. So the best course of action is to sit together and do both at the same time, medchem and the modeling at the same time, so that they can give their individual inputs and do some double checking, make the refinements that are necessary before they go on to do synthesis. So again, collaboration is very important. Even Chris Lipinski, who is the father of the famous Lipinski rule of 5, has always promoted collaboration. Now, this is just a better scenario where you have constant talk between all the different people who are involved in the study at each and every stage. Now, coming to objectives of drug discovery. So if you look at the bottom here, this is the most important mantra of the pharma industry. It's basically fail fast, fail cheap. The faster you fail, the better it is for you, your recovery of your investments. And only move ahead with the compound where you can see which part of the molecule contributes to which property and how you can change it. We can do all that here. And this can be used in association with many different other software that you can be using. There are plugins for Autolog, Flex Surface, OpenEye, etc. Now coming to missed opportunity. So this is something we discussed just before this. So you have certain filters that you apply during each stage of the study, and what you finally aim to do is to find a diamond that is going to be unit off. But sometimes, because your filters are too stringent, you may end up with a rock instead of a diamond. So, again, strategy, which I told you was a major cause of failure, is very important. Let's look at this question. You have around 200 compounds, and you have to feed these compounds you have run them through 80 tests. Advancements, especially in how we formulate our studies, how we use different tools, software, etc. And that is why you can see that in this day and age, this is the data from 2000 to 2010. And you can see that PK-ADME, which occupied around 40% last time, has come down to a mere 5%. And now the biggest contributor here is toxicity. So if you look at the toxicity, that contributes around 40% of the failure. And also because now we have very stringent measures and we have very large data sets. We have sophisticated techniques to analyze all the possible side effects, etc. And then you have strategy. So PK, ADME, toxicity, these are the best way to go ahead. And then we will be looking into SeeSAR for a little bit. I will show you how molecular docking and molecular editing for the scaffolding purposes. Thank you so much, sir. And I have to thank Dr. Patnanaban and Dr. Prashant again for their wonderful. You should be focusing on when you design a study, and within each kind of study, how do you strategize? How do you set your filtering, and how do you design a proper workflow? So I believe you may all be familiar with molecular docking, at least you have heard of it. And ADME prediction you may already have performed in some of your projects. This is not a necessary step, but if you want to do that, what you can do is you can set a constraint. This is a pharmacophore that I am defining. Okay, this is the region I'm defining, and these are the interactions that I want. I can set the radius accordingly. So this is the radius, and then the acceptors. I can choose. Okay, these are interactions. Like a lot of options are there, but right now I'm not going to apply any. And you can also analyze the different forces using the function. So you can see the balance of properties over here, right? Which molecules are better and all that. But since it is all the same molecule, you just get that. And then what else can you do? You can edit the molecule. So when I mean editing, I can either do it myself or I can ask the computer to do it. So I'll just show you another project because I am really bad at editing molecules. So let me just show you 1DWD. Continue without saving.